Good morning, Exercise Science. This is the fifth lecture from Chapter 12. It's been a long chapter, and it's a very important chapter, as I mentioned initially. So we're going to conclude it. There won't be another set of specific questions for this lecture. I'm going to start working on the assessment shortly after I'm finished filming these lectures this morning for my other classes and yours, and I'll have that probably posted within the next 24 hours, hopefully, depending how long it takes me to write it. Cardiovascular system delivers nutrients, removes wastes. At the center of it, we have the heart, which pumps the blood around the body. Obviously very important, obviously for muscle function and all function of all the body's tissues. Getting nutrients, oxygen, glucose, amino acids, anything that the body needs delivered relies on the cardiovascular system. So when we look at the heart, we talk about the right side that moves blood to the lungs so it can pick up oxygen, drop off carbon dioxide. The left side, which is going to take that blood back from the lungs and then pump it out through the entire body to deliver the oxygen to the cells, pick up carbon dioxide. The cycle repeats. We have to talk about some circulatory patterns in the body. The major circulatory patterns in the body are what are called the pulmonary circuit and the systemic circuit. The pulmonary circuit starts on the right side of the heart, goes to the lungs, gas exchange occurs, then returns to the left side of the heart. The systemic circuit starts on the left side of the heart, pumps blood to the entire body, and then returns it to the right side of the heart. You can see that the two circuits are connected. It's kind of like a Venn diagram. Excuse me, if you can visualize it that way. But understand the two words. Pulmonary refers to lungs, systemic refers to body. That is a good lead-in to our next topic, the major systemic arteries and veins. Now, this is something that I was debating about trying something different and posting a couple images during this lecture, but I'm going to rely on you to do that once this is finished or while you listen to it. I'm not going to spend a lot of time. They're all listed in your notes, and I may even miss a few. I just want to kind of make the point that arteries are going to deliver blood to the tissues, whereas veins are going to drain blood from the tissues. So when we look at these, the major systemic arteries, they're going to deliver, or supply is a word that I often use, or is often used, blood to the tissues. The three that come off the top of the aorta, if you remember that diagram that we did of the heart earlier on in the chapter, there are three that come off the top like little pipes off the top of the aorta, are the brachiocephalic, the carotid, and the subclavian arteries. The brachiocephalic, as the name tells you, brachio means arm, cephalic means head, has branches that deliver blood to the arms and to the head. The carotid delivers blood directly to the head, the carotid arteries. This is where you feel your carotid pulses. They're actually branches of two different arteries, but you can see that when you look at the diagrams, the left and the right ones. And the subclavian, as the name tells you, goes below the clavicle, dives beneath the clavicle, and it's going to supply the tissues of the thoracic cavity in the back. Now, coming off the bottom side of the heart is the descending aorta. That's when it wraps around the backside, and then it's going to supply immediately and initially the organs of the abdominal pelvic cavity, including the stomach, the spleen, the liver, the intestines. All the organs in there rely on branches of the descending aorta, rather. So a couple branches specifically that I'd like to talk about are the mesenteric, the inferior and superior mesenteric arteries. Mesentery refers to the membrane that surrounds the intestines. So the superior mesenteric is going to supply blood to the large and small intestines, where the inferior mesenteric is going to be specifically for the large intestine, more around the regions of the lower large intestine, the rectum. The renal artery is going to supply blood to the kidneys, and then when the dorsal or descending aorta comes off the back, after it goes through the body cavity with branches coming off of it, it's going to split into an upside down Y, all right? And each of those branches, which are called the iliac arteries, because of where they are near the ilium, the bone, they're going to supply each of the legs. Once they emerge from the body cavity and go to the leg, they then become the femoral arteries, which have their own branches. Spending some time with people that are in training in physical therapy, understanding these various branches of the femoral artery are going to become very important for you, but I'm not going to spend a lot of time telling you or talking to you about that right now. So obviously the femoral artery doesn't just go all the way down to your pinky toe. It's going to have its own branches to supply specific muscles and regions of the legs, lower legs, and foot. So those eventually we'll get to, possibly next year. If not, you'll get to them once you get into your post-secondary training. The veins, their job is to remove or drain blood from tissues. So the major systemic veins we want to talk about, the ones that come from the head, is called the jugular. The jugular drains the face and the head, the brain, and it brings blood out of the brain and then returns it to the superior vena cava. The one that's going to bring blood out of the arms is called the subclavian. I know there's a subclavian artery as well, but there's also a subclavian vein. It's going to drain the thoracic cavity, and it's going to drain the arms. And then the ones that are going to drain the lower body, we have the renal vein, like we have the renal artery. It's going to drain the kidneys. We have the hepatic circulation, which drains the liver. And then we have the iliac veins that are going to pull blood out of the legs. So again, take a peek in the notes at these, take a look at them, and I only covered a handful, really didn't do a lot. One other, actually, as I think of it right now, the cerebral arterial circle. So to go back to an artery, if you look at the base of the brain, take the brain out of the head and look at the inferior portion of the cerebrum, cerebellum, you're going to see a circular pattern of arteries that supply the brain tissue. This is called the cerebral arterial circle. Its old name was the Circle of Willis, obviously described by Dr. Willis, whoever that was, a long time ago, but they now call it the cerebral arterial circle. So again, in summary, take a peek at diagrams. I don't know how many of you took your textbooks home, but all you have to do is look up major systemic arteries or major systemic veins in an internet search, and you'll see the same ones that I was just talking about. All right, effects of aging. Major things that affect the circulation as we get older. You have peripheral artery disease, peripheral artery hardening, arterial sclerosis, in which the smooth musculature, the connective tissue, becomes less expansive, and that's going to increase blood pressure. So blood pressure problems become an issue with people that are aging because of the lack of flexibility in their vessels. The heart contraction power after the age of about 30 or so, 30 or 40, diminishes annually by about 1%, just at the same time that the muscular issues that we talked about earlier in the year start to occur, and they're not really issues, it's just senescence, effects of aging. But about 1% less contractile power annually after the age of 30, the heart loses its efficiency. It tends to enlarge, it tends to become fatty, it tends to become bound with connective tissue, because connective tissue replaces, in a lot of cases, muscular tissue that's been damaged. It's not functional contracting tissue. It's a space holder. But when we talk about things like the heart, which are pretty crucial, the heart is going to lose its efficiency as you get older. From a capillary standpoint, we go to a microscopic standpoint, capillary beds start to degenerate a little bit, degrade, break down. And again, this isn't, I don't want you to visualize this thing's going poof inside the body, but they become less efficient at exchange. And exchange is the important thing that the cardiovascular system, the vascular system does at the capillary level. The veins, the valves can fail. Obviously, that's going to cause backflow of blood, pooling of blood in some areas, the valves in the heart, the valves in the veins. Valves in the veins that fail will cause a condition that you're probably familiar with, or at least you've heard of before, called varicose veins. Varicose veins, besides being unsightly, just a lack of efficiency in blood flow. That's what they can rupture in some cases and cause some problems. So again, those are a few effects of aging. Take a peek at your notes for any other ones that I may have scribbled down in there. Homeostasis. Cardiovascular system. The cardiovascular system's responsibility is to deliver nutrients to the body, to the cells, to the tissues, and remove wastes. That's, in essence, what it does. You can get more specific. You talk about different systems working together. We already talked about the association between the pulmonary system, the lungs, and the cardiovascular system. Gas exchange, obviously a very important function. You could talk about the digestive system, absorption of nutrients into the capillaries that surround the small intestine and the large intestine. Endocrine system relies on the cardiovascular system to deliver hormones. And that's just three right there. There's a long list in the notes, and anything when you talk about the delivery of nutrients, you could talk about the immune system delivering or providing a pathway for white blood cells to travel around the body. So that's going to conclude the lectures for Chapter 15. I will post over the next day, as I mentioned, the assessment for the chapter. It'll probably be due either late on Friday or sometime on Saturday. I am going to have office hours again this week, so I will answer any questions that you have. Please show up probably at 1 o'clock on Thursday afternoon, which would be April 30th. So show up if you have questions, or if you just want to chat for a few minutes, probably 1 to 1:30, as I mentioned. I'll make an official posting on the site sometime later today. Have a great day.